Welcome to the A New Insight podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Hello and welcome. I am so thrilled and very honored to have quadruple board certified psychiatrist and the founder of Wellness Psychiatry, Dr. Vikas Gupta, with us today. Oh my gosh, Dr. Vikas, it's such a pleasure to have you on my podcast.
Thank you so much. It's a delight, Supatra, and you can call me Vic.
Oh, okay, wonderful. Vic. I'm going to read a little bit about my friend Vic, and then we are going to go right into the questions that we have for today. Dr. Vikas Gupta is a quadruple board certified psychiatrist and the founder of Wellness Psychiatry, serving patients in New York, California, and multiple other states via telepsychiatry. His practice specializes in integrative evidence-based psychiatric care across the lifespan, with a focus on holistic wellness, weight management, and lifestyle medicine. A nationally recognized leader in psychiatry, Dr. Gupta has served on the faculty of Harvard Medical School and Massachusetts General Hospital, the nation's top-ranked psychiatric hospital. He currently holds leadership positions within the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry, where he contributes to education, curriculum design, and continuing medical education initiatives. He also collaborates with the FDA network of experts and is a member of the APA Research Council. Dr. Gupta's clinical focus includes helping high-performing professionals manage stress, burnout, and complex medication regimens, while also offering innovative treatments for obesity and mood disorders. Through his Wellness Psychiatry platform, he blends psychiatric expertise with whole person wellness to help patients achieve lasting transformation. Vic, welcome.
Thank you so very much, Supatra. I'm so delighted to be here with you.
Oh, well, thank you
Thank you
so
for
much.
inviting me.
You are honoring me with your presence in this podcast. You have, I think, a very prolific and unique career that blends psychiatry, obesity medicine, and holistic wellness. Tell me what your inspiration was to pursue this path and what continues to drive your mission in your practice.
So I'm a psychiatrist trained to think in diagnostic codes, but our patients live in bodies, families, workplaces, and kitchens. So the practice wellness psychiatry was born from realizing that mind, metabolism, and meaning are inseparable. During residency training, I had seen patients being labeled treatment-resistant depression, yet other factors were implicated. Sleep was perhaps complicated or chaotic. Meals were somewhat not very healthy, maybe ultra processed, and movement was non-existent. So when I trained in obesity medicine, a light bulb went off. Food and metabolism, as you know, constantly talk to each other. Low energy, inflammation, and glucose swings can mimic or magnify our mental health conditions or psychiatric symptoms. So I built a model that treats the three layers together. One was the physiology, which includes metabolic health, weight biology, and hormones. Second was the impact of psychology, including habits, motivation, and other factors like trauma. And third, very importantly, is purpose, which included factors like creativity, connection, and values. Um, what what I foresaw was that we align all these three factors. People don't just lose weight; they regain agency and vitality. And our mission at Wellness Psychiatry is to make sure that we provide humane, evidence-based, and doable care. Less about heroic willpower, but more about building smart systems that can fit real lives and can
I
work for real
love
patients.
this. I think one of the main reasons, other than your amazing reputation, that I wanted you to have on this podcast was to talk about how lifestyle medicine, more natural nutritional interventions, and things like that have gone the wayside with the advent of these medications originally designed for diabetes management, GLP 1s and their derivatives. And I'm seeing a lot of difficulties with, you know, disordered eating, eating disorders, confusion about nutrition. And so that's why I really wanted to pick your brain today, was to figure out how we can best help people that are struggling either before taking these medications, during, after. How can we be providing them with the best care and the most up to date nutritional education, as well as giving them some psychological and psychiatric support? So let's start with nutrition. So many people on these GLP-1 medications really struggle with nutrition. I see a lot of confusion, especially just anecdotally online, about macronutrient proportions, about calories. From your integrative psychiatry perspective, how should patients think about nourishment versus just calorie restriction when on these medications?
Such an important question. So the GLP-1s do lower appetite, but they obviously don't teach nourishment. Um, my mantra is to eat less by default, not by depletion. And obviously, when appetite drops, people often eat too little of the wrong things. I recommend focusing on quality over quantity. So ensuring there is protein anchored diets, fiber forward diets, minimally processed meals. As you're aware, proteins are important to preserving muscles and maintaining the mood stability, whereas the fiber intake is important to for the gut to support the microbiome as well as to study the glucose levels in the body. Um, Also important is the fact that healthy fats are needed to keep the brain and hormones balanced, especially for our vegan patients or plant-based patients. This may look like lentils, seitan, beans, tofu, or colorful produce, which we get plenty in California and several other states. We schedule meals because hunger cues can vanish after the GLP-1s, and structure does protect the mental health, metabolic health overall. So I do recommend scheduling meals given the cues can go away. Do set the calories. I would say calories do set the budget, but nutrients decide what you can actually build. So nourishment is real important information to the brain. It shapes our emotions, it shapes our focus as well as our resilience and overall good mental health. So the fact that balanced nutrition is needed once patients
Oh,
start on GLP-1s is
absolutely.
critical.
And I see out there an overemphasis on protein as the most important macronutrient that you can consume. Now, I understand that because these medications, especially if you are consuming far fewer calories than normal, you will experience first water and muscle loss, most especially if you are on a high protein, low carbohydrate diet. And that's what we've seen in dieting since, Atkins revolution and all of these, paleo, more animal protein centered, low carbohydrate diets. And so, my point to many people is that if that actually worked before GLPs, we wouldn't need GLPs. It really doesn't work. If you see a very high, especially animal protein centric diet, it eventually starts to backfire on you. You may lose some water and you may lose some muscle in the beginning of the diet, but long term consumption actually damages kidney and liver function, contributes to cardiovascular disease, and contributes to insulin resistance. So, how can we help people turn away from that thinking, especially when they are, you know, eliminating carbohydrates, especially fibrous carbohydrates? What should the messaging actually be? Because most doctors are saying just eat high protein, low carb.
I think that's a great point. And coming from someone who has expertise in this domain, I would defer this to you. But I agree with you that sometimes the messaging has been somewhat erroneous and erratic in a way that
Mm.
high protein is what you need, whereas there needs to be a balance and there needs to be all different, carbohydrates need to be there, fats need to be there, healthy fats need to be there. So I think a more optimum messaging needs to happen. Unfortunately, in medicine, a lot of nutrition education is not there and missing. So I would definitely encourage working with experts in nutrition and folks who actually do this my day-to-day stuff, and physicians collaborating with them and educating their patients in what is optimum, what is healthy, what is nutrition, and optimizing their targets in terms of weight loss, but as well as ensuring there's least amount of protein loss, and there is no over focus on one
Exactly. And
specific topic.
we met originally online, but then you invited me to the American Psychiatric Association's conference, which was amazing. Such an honor to be able to go there. And one of the keynote speakers was Dr. Dean Ornish, who I just have a geeky crush on because he's an amazing scientist and doctor. And I think looking into evidence-based nutrition studies and work, especially when it comes to overall disease prevention, but also just natural, healthy weight loss without dieting, is really important, especially when you're on a GLP-1. And if you look at his lifestyle heart intervention, you look at the work of Dr. Caldwell B. Esselstyn, they really do promote, in terms of the overall healthiest diet that will minimize any disease risk, but also just naturally keep you slim, is a whole food plant based diet. Doesn't have to be completely 100% plant based, but majority plant based has been shown to really help. And so that would be my suggestion as a dietitian. And I think going to dietitians and nutrition experts that understand the current evidence based nutrition is going to be really helpful for you when you are on a GLP-1. I think it's also really important. Another person that you had at the conference was Dr. Sachin Panda, and I'm very much geeking out about him because he was just on my podcast. I was able to meet him and have him on. He does a lot of research in terms of circadian rhythms. He was the one who found the light sensing cell in our eyes called melanopsin, and really was kind of at the forefront of blue light damage to our sleep, and how important setting our circadian rhythm. When we work in concert with a more of a whole food plant-based diet and we're really conscious of our circadian rhythm, that actually helps naturally produce GLP-1 and all of the other appetite suppressing hormones. So I encourage people to go and look at the work of these people, and really find out how we can naturally do this, because I don't think it's hardly anybody's goal to be on these medications for life, as they are, touted to have to be. We don't have to be. We actually make our own GLP-1. So that would be my suggestion as well. So let's talk about alcohol. I've seen a lot of questions about alcohol. I've also seen in some of the research that people's desire for alcohol goes down when you're on GLP-1s. What are the concerns around alcohol use when you're on these medications, and what are the specific risks people are not aware of?
Absolutely. So with GLP-1s and alcohol, your two systems are in collision. Uh, One, the GLP-1s, which are slowing the digestion and blunting the reward pathways, while alcohol, which is both a gut irritant and a dopamine shortcut. So physiologically, there is slowed gastric emptying that is happening, which means alcohol will hit faster and stronger if someone is consuming alcohol on GLP-1s. And even one drink can cause way more nausea, dehydration, or dizziness. And skipping meals and drinking is especially risky because the blood sugars can dip, the judgment can slip, and the sleep quality can be impacted. In terms of psychological factors, when the food reward goes down, some people unconsciously replace it with alcohol and seeking the same dopamine hit elsewhere. And that substitution risk is real. So I usually advise a few week period, usually 3 to 4 weeks, alcohol free, while titrating medication and then reassessing. If reintroducing alcohol, I recommend pairing with food, hydrating and limiting portions. Um, and if someone's drinking to take the edge off appetite suppression or emotional restriction, then obviously they need a lot more work in therapy and other supports that they might need. Um, One thing to remember is that the GLP-1s do lower appetite, but they don't raise the
Wow.
alcohol
So
tolerance.
just to be clear, do the GLP-1s alter alcohol metabolism? Does it slow the alcohol metabolism itself?
Yeah, so not necessarily. It's just that it
Mm,
stays longer in the system. And obviously, when there is slower gastric emptying, the alcohol can hit faster and stronger. And the impacts, the absorption can be significant. The other piece is, given there is decreased appetite with GLP-1s, um, folks can feel one drink way more significantly than how they would otherwise feel
okay.
without the GLP-1s with
But
while they're eating
I've
very
also
little.
heard that people's desire for that actually goes down. And
Mhm.
from what I can tell,
Goes
it's
down.
because we do have GLP-1 receptors in the brain. And so they seem
Yes.
to be less, there seem to be less cravings for alcohol because of that reason. Is that pretty accurate?
Yes, yes. So yeah, so regarding the metabolism piece, so it's not necessarily the metabolism, but yes, the cravings piece. Certainly, GLP-1s are being studied in alcohol use
Hmm.
and other addictions, and there is promising data to say that it can really lower the cravings and the desire for that repetitive, you know,
Yes.
reward pathway
Yes.
that goes with the alcohol. So yes,
So you
they have value in
mentioned
that domain.
delayed gastric emptying, which is a big effect of the medication. You also mentioned nausea. So I really want to delve into some of these side effects. I'm seeing so
Mhm.
many people online complaining of hair loss, significant hair loss, nausea. I have seen people have constipation for days, sometimes bloody and black stools, vision problems. Let's talk about symptoms and symptom management. How can we help people who are experiencing such extreme side effects?
Well, great question. So these are all real side effects that we see with patients. Nausea is probably the most common side effect, and basically it's a signal, right? The goal is to kind of understand it, respect it, not push through nausea. Um, it does give us some framework also to work with in terms of dosing, timing, texture, and tempo. So what is telling us for the dose is like going slow and holding or stepping back if the nausea does spike and doesn't go away. Usually, rushing the dosing or rushing the titration upwards causes most issues. Um, Also, timing wise, some do best dosing in the evenings and sleeping through the peak dose. Also, while someone is getting onto the GLP-1s or escalating doses, the texture of items that they eat or the foods that they eat is significantly important. So maybe taking in some small, soft, simple meals like soups, smoothies, lentils, cooked veggies, and avoiding sugary or greasy
Hmm.
foods is critical. I've seen a lot of folks, a lot of patients who are eating fried foods complain a lot more about nausea. So those greasy foods definitely tend to trigger more of this. The other piece is the tempo of eating, like eating slowly and sipping through it steadily and moving gently after meals. Um, I've also clinically seen that the nausea is way more significant after each specific dose for a day or so. So ensuring that the day that they are going to take the medication, the day off, and the subsequent 1 or 2 days, the meal consumption is somewhat limited, because what can happen with the GLP-1s is like when it comes time for the next weekly dose, your appetite can be triggered a little bit, and you may actually end up eating a lot more than what you would during the early phase of the GLP, after the GLP-1s have been um, injected. So the day off and the subsequent couple of days are critical to not eat too heavily. The other piece is constipation sometimes can also masquerade as nausea. So fiber and magnesium intake early on are helpful. Sometimes short courses of ginger um, or anti-acid medications or antiemetics can help. If the nausea persists besides these adjustments, we sometimes pause or reduce the dose even, because the best medication is the one a patient can live with. So we sometimes have to be very flexible. My motto with the medications is to go slow to go far. So really kind of being gentle with the titration. Sometimes we say, in excitement that we go quickly every week or 2 weeks. So I've seen best results with
Wow.
gentle
It's so
titration.
interesting. I personally love your advice, and I don't see that as often as I should see that. There with my clients who come in after listening to their doctor or psychiatrist or what I see online. And what is so interesting about your advice, Vic, is that that really is wonderful advice for anyone, even if they're not on the medication. When we follow our circadian rhythm by, trying to wake more when the sun is coming up, trying to eat more earlier in the day and focusing on fiber rich meals, most especially in the morning, and then tapering down our food towards the evening, but really focusing on these whole foods throughout the day, trying to get adequate sleep, making sure we're walking and moving throughout the day. All of those things help increase our GLP-1, GIP, and PYY production. And I love, 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 and we never hear this, eating mindfully. When we actually slow down,
Yes.
there's a process in our digestion. Our digestion actually starts with looking at food, and our salivation when we're looking at food, when we really slow down. And here's the thing, I think a lot of people really become, because of dieting, afraid of hunger. Hunger is not bad. Hunger is
Mhm.
a sign that your body needs nutrition. And I think when we deny that, that's when we get out of balance with our hormones. But when we eat when we're hungry and we eat slow enough and mindfully enough, we then allow our brain to register the presence of food in our stomachs, and we stop when we're feeling that satiation and that fullness. And all of that also goes into hormonal balance. So we need more psychiatrists like you, Dr. Gupta. We need people who are trained in lifestyle medicine. That's why I thought that the psychiatric conference, which the focus was on lifestyle medicine, was so good, because doctors, they just don't get this nutritional advice or education in their programs most often. But you can get it in your continuing ed from people like Vic here. So, as a psychiatrist, Vic, how do you see GLP-1 medications affecting mood, motivation, or body image? Are there some psychiatric red flags that might be missed in a strictly medical weight loss setting?
Great question. So I see that there are three domains really: mood, motivation, and self-image. And GLP-1s can impact these three in all nuanced ways. With mood, we've seen that some patients feel brighter as the inflammatory processes and their sleep improves. Uh, but also, we've seen that underfueling or low hydration or caffeine or alcohol changes can trigger anxiety or irritability in terms of their mood. In terms of motivation, we've seen that the reduced appetite can sometimes free up the mental bandwidth. But we've also seen that for a subset of our patients, that GLP-1s may blunt the drive. They may eat too little, and may feel emotionally flat and may complain of feeling down. Um, as regards to body image stuff, rapid physical changes can outpace the psychological adaptation, and patients sometimes struggle to recognize themselves or feel pressure to maintain their results. In terms of red flags to watch out for when someone is on GLP-1, I think there is one concern for emerging disordered eating, which includes like feeling guilty about food, compulsive tracking of food and diet, and meal skipping. The other important red flag to watch out for is flattening or affective flattening or irritability or overall depression after dose increases. Um, there could also be substitution behaviors where folks use alcohol or stimulants instead of food. And there is also, on occasion, there is issues with folks reporting old trauma kind of resurfacing once food is no longer helping regulate emotions. Therefore, I would say that while on GLP-1s, a good psychiatric screening at baseline and during those increases is critical. We are not just treating weight. We are also tending to identify issues with motivation, emotional safety, and mood. Um, Also remember, and I tell my patients, weight is just a number, but the well-being is the most
Yeah.
significant and critical fact. And my job really is to help my patients author a healthier, narrative for themselves
Oh,
and
that's
their loved
really
ones.
great advice. I think we see a lot of these complications too, just in regular dieting. People, especially if they're consuming very, very, very low carbohydrate, that greatly affects the mood and contributes to anxiety and depression, which is all the more reason why incorporating more whole foods and plants into whatever it is, if you're on medication or you just wanting to lose weight or increase your health, please do not restrict your carbohydrates because that's going to greatly contribute to a poorer mood. And certainly, I think there is a lot of confusion that happens for people when they lose their appetite, and it's very difficult for them to eat. Very, very difficult for them to even think about consuming maybe even 800 calories, which is not going to be good for anyone. So, if you are experiencing that, you probably should go to your doctor and maybe perhaps lower that dose so that your weight loss is more gradual, it is more healthy, it is more sustainable. I love this. And we're going to get more into disordered eating and eating disorders in the second half of this podcast, Vic. But oh my gosh, you have been a wealth of information so far. And I am so excited to learn more from you in this second half. So, will you come back and join me?
Yeah, looking forward to that. Thank you so
Thank
very
you.
much.
And thank
God
you,
bless.
everybody, for joining us. Please do come back for the second half of this incredible, informative interview with quadruple board certified psychiatrist and founder of Wellness Psychiatry, Dr. Vikas Gupta. Thanks for tuning into the A New Insight podcast. Please remember the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anu.insight and at anu-insight.com under the A New Insight podcast tab. And follow us on our socials at my.anu.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.